Opioid addiction in Utah is a statewide crisis. Families, friends, and children are all hurting from the effects of this rapidly spreading epidemic. Tonight, we're tackling addiction together.
Good evening. Welcome to this Healthy Mind Matters special. In 2017, Utah saw on average 30 deaths to opioid overdose each month. That's one person dying every day.
While deaths to prescription opioids have decreased over the last couple of years, heroin-related deaths are increasing. Doctors, researchers, and families are saying this crisis demands everyone's efforts.
Sadly, opioids affect people who are younger all the time. Two families who've experienced tragic loss firsthand are on a mission to teach kids about the dangers of opioids in Utah at an earlier age.
These are some of my favorite photos of him.
Casey and Brooke Schofield.
We went sleigh riding as a family. That's when he was sober. We had him back.
And Tiffany and Jason James both share the same nightmare.
He's a fun, outgoing, had a lot of friends. He's a good kid.
They each lost their sons this year to opioids. Two families now grieving in their absence.
This was a picture of him 2.5 years sober.
Braxton Schofield's addiction started young.
But we had no clue until he was about 18 how serious it was. He was really good at covering up.
His parents couldn't understand why he turned to drugs.
We ate dinner together every night at 5 o'clock. We went boating. We went on vacation.
But the addiction was stronger.
Just a normal kid that made a bad decision, and it took him over.
Rehab kept him sober for 2.5 years.
He got completely out of the system, no fines.
We had our son back. He was doing family things with us, and he was happy.
He was special, for sure.
But at just 25 years old, one last relapse was the end.
And that morning I got a call that he had gone into cardiac arrest and didn't make it. Worst day of my life.
The Jameses share a similar story. Their son Colton tried heroin for the first time at a party with friends.
3 of them are dead, including my son.
They tried everything, took away his cell phone and car, but nothing stopped him.
They were sleeping in the doorsteps at the libraries downtown, close to wherever they could get the drugs.
They put him in rehab, but their insurance company only covered 30 days. He overdosed soon after.
Just started begging him not to go.
But it was too late for their 22-year-old son.
This is an epidemic. It's killing people every day.
Today, the Jameses and the Schofields are on a mission to make a difference. They started an organization called the Carry Me campaign.
We tried that, had an exclamation point. We had some different...
It's designed to increase prevention and help people through recovery. They've partnered with the Ron McBride Foundation, which sponsors golf tournaments to raise funds. Coach McBride says the proceeds will help implement new curriculum called Healthy Learners in some of our schools.
Help young people make better decisions, make sure the parents are aware of what's going on with their children.
Their first priority is to start teaching kids as early as elementary.
The goal is to save lives.
We want them to have a clear understanding of the dangers.
This fall, the Salt Lake, Ogden, and Jordan school districts will pilot the new program. David Compton says the model teaches kids to make informed decisions with consequences.
It's going to be that moment when somebody says, "Would you like to try this?"
The Schofields and Jameses will share their stories in the classroom.
I think if Braxton would have had a good early education about what his life might turn to once he started doing these drugs, I don't think he would have chose that.
They also hope to sponsor recovering addicts through rehab and teach parents what signs to look for.
We want people to talk about it. We want people to say, hey, don't be ashamed of it.
They say this crisis demands everyone's efforts.
So our efforts will carry them because they can't carry themselves.
To carry children, addicts, parents, teachers, and families.
You know, I'm going to die fighting this just like my son did.
Tiffany James says she wishes she had access to naloxone, an opioid blocker, the day she found her son passed out on the bathroom floor. She says it could have made the difference. Naloxone, also known as Narcan, is designed to rapidly reverse an opioid overdose. People who overdose often stop breathing, are unresponsive, and has small pupils and a blue-gray skin tone. It's administered through a simple shot in the arm. Utah Naloxone's medical director, Jennifer Plum, says anyone could be a first provider and a responder in an emergency.
First person there needs to be equipped with naloxone, because if somebody overdoses, you have precious minutes to get them breathing again.
Plum says we should have naloxone available in all homes and settings. A free dose is available without a prescription at local libraries and in more than 500 pharmacies across the state.
A lot of folks struggling through opioid addiction often face the burden of additional mental illnesses like depression, anxiety, thoughts about suicide. Intermountain Healthcare recognized the need to help people in immediate crisis. One man credits his life to this program.
Jacob Koger is cutting carbon fiber, building composites, and solving algebraic equations.
It's a fiberglass woven cloth.
He's in school learning to build parts for airplanes, but just 14 months ago, he was in a crisis.
It was either get help or end my life.
Like many, Koger's opioid addiction started with prescription pills for neck and back pain, but soon spiraled out of control.
I had lost my home, all my possessions, marriage.
Koger hit an extreme low.
Overpowering feeling of worthlessness, just that nobody wants you around anymore.
He checked himself into Intermountain Healthcare's Behavioral Health Access Center at McKay-D Hospital. Similar to an emergency room, it is designed for patients in mental health crises.
I was able to speak with a crisis counselor as soon as I got there.
Intermountain's Karen Dewey first greeted Koger.
They don't look good when they come in.
A team of nurses, therapists, and psychiatrists assess each patient's needs.
To help someone stabilize to the point where they can live healthy and well outside of the hospital setting.
Koger spent 27 days in the behavioral health unit. Then Dewey connected Koger to a community partner that offered further services.
We can get those resources for you. You just got to hold on to them and keep moving forward.
With the help of medication and therapy, Koger made it.
You are cared about.
I can't describe the feeling of, being able to wake up and focus on everything else in your life other than drugs. It's a fight every day, but don't give up.
Intermountain opened an additional access center at LDS Hospital in Salt Lake earlier this year. It's open 24/7 for patients in immediate need.
When she sees him, she squeals and knows that it's time to play.
Coming up, how the relationship between two people has transformed broken lives.
I couldn't handle anything that was beyond just concentrating on the pain.
And alternatives to managing pain. How one woman is finding choices beyond painkillers.
So what do you do if you've got serious chronic pain and you need opiates to live your life, but you don't want to live with those drugs? You think you're stuck.
That's what one Salt Lake woman thought. Reporter Peter Rosen has her story.
I loved being active.
Lindley Murphy.
I used to be a big runner.
Just kept moving.
Climbed Mount Kilimanjaro.
Until an accident in a bike race.
I hit a pothole and just came down hard. Shattered my coccyx.
Brought her to a dead stop.
The pain was just so great. It consumed my life.
To manage the pain, her doctor prescribed opiates. As a UVU public health instructor, she was more than aware of the risks.
Knew that I was on a very, very dangerous slippery slope.
We met towards the end of June.
But eventually she ended up here, under the care of Dr. Robin Oakey.
Are you still getting some relief from the injections? What we want to do is help people learn to manage their pain, to minimize the consequences of the pain.
He replaced the opiates with multiple options.
Pharmacological strategies.
They're steroid injections.
We can burn those nerves. Counseling and cognitive behavioral strategies.
And to try to train my mind to move away from it through mindfulness.
There's rehabilitative strategies, working with physical therapy.
I started yoga. I've tried acupuncture.
The most important thing is education. When patients are educated, they make better decisions.
Pain changed Lindley Murphy.
I didn't laugh. I don't remember smiling very much. I couldn't handle anything that was beyond just concentrating on the pain. The greatest message I received was hope.
She still has pain, but she can manage it.
Like I'm getting back to my life.
Without opiates.
It's good. Life is good.
Peter Rosen, KSL 5 News.
Murphy was taking OxyContin and oxycodone, but Dr. Oakey replaced those with a safer opiate and has been slowly reducing the dosage. Next month, she will take her final pill.
Researchers are finding acupuncture to be another effective alternative to fighting addiction. BYU psychology professor Dr. Scott Stevenson is working with students to study the neuroscience behind acupuncture. They discovered it activates the same sensors in the body that produce dopamine, the chemical that gives a euphoric feeling when someone uses an opioid. Dr. Stephenson says increasing dopamine levels with acupuncture can help reduce opioid cravings.
Up to a point where the person is feeling better, they can make better decisions.
Stephenson says it's not a cure, but can alleviate withdrawal symptoms like stress and anxiety. Dini?
Tonight, we're privileged to have Intermountain Healthcare's Bridget Shears with us. She is an expert in finding alternatives to managing pain other than opioids. Thanks for being with us today. You know, we heard in one of those last stories that sometimes some pain is necessary. We shouldn't try to reduce all pain.
Correct. I mean, pain is a signal. It basically informs and protects us. So yes, it's unrealistic to expect that we'll never have pain. But pain, if we don't listen to it, we could miss that signal. It could be a sign that something is wrong.
Okay. What is your organization doing to help reduce the number of opioids in people's hands?
At Intermountain Healthcare, we have an opioid prescribing dashboard. We understand how patients use the opioids that are prescribed to them, as well as understand how our providers prescribe those opioids.
So what does that look like? You track the doctors, and they know, and you know who's prescribing what and how many.
Right. We use that information that comes from our electronic health record to inform individuals, and we also understand that we can use that data to help educate them.
And so tell me a little bit about your Use Only as Directed campaign. It's visible throughout the hospital. Patients see it, doctors see it.
Right. It's really a public awareness campaign. We want our public to understand that there are some dangers related to opioids, and they can make choices. Speak up. Speak out. Talk to your doctor and your provider about the plan for your pain management. Opt out. If you're not comfortable with it, there are alternatives that you can try. And throw out. Stop saving those leftover medications. Get them out of your medicine cabinets and out of your home. We have disposal boxes across the state. You can go on useonlyasdirected.org to find out all the different locations that we have.
Whole new way of looking at this, Bridget. Thank you very much.
If I didn't have my substance, I laid in bed and shook and slept until I got my phone call.
Next, a lifetime of addiction and the unexpected solution that pulled this man out of despair.
Addiction is a devastating disease, often hurting the lives of family members behind the scenes.
And yet, a key to overcoming it has so much to do with building relationships with loved ones, as Lori Pritchard reports.
41-year-old Dawn Hutchings and 7-year-old Emma Robinson have one thing in common.
Yeah, there you go.
They've both overcome a drug addiction. But their journeys could not be more different.
Emma was 2 pounds, 2 ounces.
Freya Robinson and her husband adopted Emma at birth.
She loves to play with sensory toys that light up and play music. Music is her language.
Emma's birth mother was addicted to opioids. So addicted that even becoming pregnant couldn't stop her from using them. Emma was exposed to the drugs in utero, significantly altering her development.
She's nonverbal, she's legally deaf, and she's legally blind.
3 weeks after birth, Emma's system was finally drug-free. Around the same time, Dawn was also reaching his own sobriety.
I've struggled with a lifetime of addiction.
After his father went to prison, Dawn fell into a deep depression and self-medicated with methamphetamines.
If I didn't have my substance, I laid in bed and shook and slept until I got my phone call.
Pouring $350 into the addiction daily. Sitting in jail time after time finally triggered a change.
I'm like, is this really what my whole life has come to?
Oh yeah, you excited?
Dawn and Emma's lives crossed paths when he volunteered with a group called Addict to Athlete, a program designed to help people battling addiction by training for and racing in marathons.
I went up purely out of greed. I wanted to sign off some community service hours.
But it didn't take much to change his heart.
There was an energy about the team. You could just feel it.
He soon fell in love with little Emma and they became running partners. Dawn pushes Emma in a specially designed racing stroller.
And when Emma sees it, she is just lights up and giggles and bounces and squeals, and it is the best thing for her.
The program's director, Coach Blue Robinson, says running marathons is a lot like the journey of recovery.
It sucks. It's hard, you know, but when you're done, you feel good.
As an addiction counselor, he found running alongside his athletes to be the best therapy.
They'd tell me more outside on a training run than they ever did in my office.
And offered a new meaning for life.
To allow them to erase the addiction and replace it with things of greater value.
Like bringing healing to two families, each suffering from the bonds of addiction.
It's not just the addict who suffers, it's the family too.
Dawn's wife, Brooke, who also volunteers with the team, says it saved their family.
Because we have a whole community that surrounds us, and we all recover together.
And it gave me my connection with people that were like-minded, people that were on the same journey.
Dawn's 11-year-old son, Russell, cherishes his time with his dad.
Why I run is now I can spend time with him, because back then I couldn't.
Can we swing?
And Freya says becoming friends with Dawn and his family has helped her understand how hard it was for Emma's birth mother to quit.
I didn't understand that until I got to know people that have really been through the battle and come out the other side.
Dawn's service enables Emma to move in ways she otherwise could not.
Racing gives her the ability to be free.
And the bond Emma and Dawn share?
Even though she has trouble seeing and hearing, she knows when I'm there. She can feel me.
Freya believes Dawn's presence comes from a higher power.
It's a complete blessing. And our angels that push our kids, they're a godsend.
In October, the Addict to Athlete team is flying to Washington, D.C. to support Dawn and Emma, who are running in the Marine Corps Marathon.
The group has more than 2,000 athletes in Utah. You can find more information on how to volunteer with the team on KSLTV.com. We'll be right back. Everyone can play a role in stopping this opioid epidemic from progressing.
Here are a few simple ways you can prevent an addiction to prescription opioids from ever starting. Intermountain Healthcare encourages folks to talk to their doctor about alternatives to prescription opioids. Never share your prescription and dispose of all unused and expired prescriptions properly.
Become familiar with the signs of an overdose and always carry naloxone on hand in case you find yourself in an emergency.
As we've seen here tonight, tackling this epidemic requires everyone.
Thanks for joining us on this Healthy Mind Matters special. We'll see you back here tonight at 10, right after Dateline.